Medications that are taken for some purpose are good, but an overuse of certain medications can have you face some serious consequences. One of such consequences is the liver damage. Liver damage can occur by the use of certain medications, and we're pretty sure that you may have some of these medications at home right now. Finding out if certain medications that you are taking are good for liver health or not is very crucial. So in this video today, you are going to learn about the signs of liver damage that you need to watch out for, how to prevent such damage from occurring, and how to find out if the medications you're taking are harmful for your liver. Let's begin. Your liver is known to be the largest solid organ inside your body. This football-sized powerhouse helps keep you alive and healthy. As you move throughout the day, it works hard to purify your blood, aid digestion, and replenish your energy reserves. You cannot live without it. Your liver also helps to metabolize drugs. Some medications, however, can cause direct harm to this critical organ, a condition known as drug-induced liver injury. As you eat, drink, and take medications and supplements, your liver is the unrecognized hero, tirelessly filtering these substances, storing nutrients, and eliminating waste. This constant processing significantly increases the risk of encountering harmful agents, with various studies indicating that a variety of medications, including herbal medications and dietary supplements, can increase the likelihood of liver damage. So let's talk about the popular medications that can increase the risk of liver damage. 1. Tylenol. Tylenol, which usually contains acetaminophen, is a popular OTC pain medication and fever reducer. When consumed in moderation, it does not harm the liver. However, high doses and/or long-term use can induce liver damage. In fact, even a large dose of Tylenol can cause liver damage. This is known as Tylenol overdose, and it is a medical emergency that requires rapid treatment. Thus, in case of any unexpected situation, or if you suspect that you have taken too much Tylenol, you should see the nearest emergency room or get some immediate medical help. Tylenol can also cause liver damage if it's taken too frequently, especially over a prolonged period of time. This concern is more relevant among people who have a serious illness. Alcohol. Use disorder or pre-existing liver issues. You can reduce the risk of liver issues associated with Tylenol in the following ways. Do not exceed the maximum suggested dose, which is 4,000 mg per day. Avoid drinking alcohol while taking Tylenol. Check to discover if any of your over-the-counter or prescription pain relievers contain acetaminophen, so you don't mistakenly take it from numerous sources. Keep in mind that Tylenol is also present in many over-the-counter cold and flu medicines. 2. Antibiotics like Augmentin. Augmentin, which usually has amoxicillin clavulanate in it, is a commonly prescribed antibiotic for respiratory, ear, and skin infections. The antibiotic is the most likely to cause liver damage. However, this is not a typical adverse effect in general. Augmentin medication often results in liver injury between a few days to 8 weeks. This is more likely to affect men, older adults, and those who have taken Augmentin several times in a row. Fortunately, the injury is frequently reversible and has no long-term repercussions. 3. NSAIDs like ibuprofen or diclofenac. Non-steroidal anti-inflammatory medications, or NSAIDs, are routinely used to treat pain, inflammation, and fever. Some are accessible over-the-counter, like ibuprofen, while others, such as oral diclofenac, require a prescription. Diclofenac is among the most likely NSAIDs to induce liver damage. In many situations, the damage is severe enough to elicit high liver function tests, or LFTs, but insufficient to cause symptoms. LFTs detect liver enzymes and proteins, and higher levels indicate possible liver damage. Your healthcare professional collects these values through blood tests. Serious liver damage is rare. However, the danger is greater for women, larger doses, and/or long-term use that is more than 4 weeks. It is important to keep in mind that diclofenac is also available in topical formulations, including gels, creams, and patches. Topical versions pose a lower risk of liver harm because a lot smaller amount is absorbed into your body. 4. Amiodarone. Amiodarone, also known as Pasarone, is a medicine prescribed to treat irregular cardiac rhythms. LFT levels rise in up to 50% of patients who take amiodarone for an extended period of time. However, this rarely leads to major health consequences. In some situations, however, amiodarone might cause significant liver damage. This is expected to affect up to 1% of those taking the medicine. The FDA issued a boxed warning, its most serious pharmaceutical warning, on this possibility. Liver harm from amiodarone is more likely in those who take it at greater doses and for longer periods of time. Fortunately, this danger can be managed. You will most likely undergo regular LFTs while on amiodarone to ensure that your treatment does not need to be modified. 5. Allopurinol. Allopurinol, or Xyloprim, is a medicine used to prevent gout flare-ups. Some people take it to avoid specific types of kidney stones. In rare cases, cancer patients take it to prevent a condition known as tumor lysis syndrome. Up to 6% of allopurinol users experience small, reversible increases in LFTs. This normally doesn't cause any long-term issues. Less frequently, allopurinol can induce liver problems as part of a larger disorder known as drug reaction with eosinophilia and systemic symptoms, or DRESS. DRESS syndrome is a medication-related reaction that involves fever, rash, and abnormal blood tests, among other symptoms. Allopurinol has also been linked to serious skin responses, including Stevens-Johnson syndrome, or SJS, and toxic epidermal necrolysis, or TEN. These disorders can also damage your liver. 6. Anti-seizure medications like phenytoin. Anti-seizure drugs are frequently cited as potential causes of liver harm. Phenytoin, or Dilantin, is one of the leading causes of DILI and liver failure. However, liver damage caused by phenytoin is extremely rare. It occurs in less than 1 out of every 1,000 people who take the prescription. Liver injury usually occurs 2 to 8 weeks after phenytoin medication begins. Almost all phenytoin hepatotoxicity cases occur as a result of larger pharmaceutical responses that impact the entire body, such as anticonvulsant hypersensitivity syndrome, or AHS, DRESS, SJS, and TEN. However, the majority of cases of this type of liver impairment resolve within 1 to 2 months of discontinuing phenytoin. Other anti-seizure medications that have been connected to liver problems are valproic acid, or Depakine, carbamazepine, or Tegretol, and lamotrigine, or Lamictal. 7. Isoniazid. Isoniazid is an antibiotic that effectively prevents and treats TB. However, it is one of the top 10 most probable drugs to induce DILI in several countries. Increased LFTs can impact up to 20% of those on isoniazid. However, only approximately 1% of those using the drug have genuine liver damage. The majority of isoniazid-related liver issues are minimal and/or disappear within 1 week of discontinuing the medication. But isoniazid comes with a boxed warning about the potential of serious liver inflammation. The risk of liver failure related to isoniazid is higher for women, Black people, and people with... It's also higher for older adults and people who drink alcohol daily. Weight, azathioprine. Azathioprine is a drug that deliberately suppresses the immune system. It is often used following an organ transplant and for the treatment of autoimmune disorders. Azathioprine can induce a variety of liver injuries. These range from minor transient elevations in LFTs to long-term damage that can occur 1 to 5 years after beginning azathioprine treatment. Azathioprine-related liver damage is most common in persons who have had a transplant. Typically, discontinuing azathioprine medication resolves these difficulties. However, your healthcare professional will most likely routinely monitor your liver health while you are taking the medicine. 9. Methotrexate. Methotrexate is primarily used to treat cancer and autoimmune diseases. However, it does include a boxed warning about the potential of liver damage. The degree of harm varies with the dose and duration of treatment. High doses of methotrexate administered by IV can induce significant increases in LFTs. However, because high doses are not administered on a regular basis, liver enzymes usually return to normal without causing any symptoms. These doses are typically provided in a regulated medical setting. Lower daily doses of oral methotrexate are less likely to elicit significant LFT alterations. However, they may increase the risk of fatty liver disease and liver scarring. This is particularly likely in those who already have risk factors for these illnesses, such as heavy alcohol consumption or obesity. 10. Other cancer medications. Many cancer treatments, including chemotherapy, targeted therapies, and hormone drugs, can cause liver problems. Pembrolizumab and nivolumab are two examples. These drugs, known as immune checkpoint inhibitors, ICIs, help the immune system recognize cancer cells. However, they can occasionally cause the immune system to overreact and assault healthy cells. This causes liver inflammation in up to 6% of patients using ICIs. If you are taking a drug that has a risk of liver-related adverse effects and experience symptoms of liver inflammation that last more than a day, notify your healthcare team right once. They will most likely evaluate your LFTs and decide whether you should stop taking the drug. If you are unsure whether a medicine poses these risks, contact your pharmacist. And there you have it. Let us know in the comments what are your thoughts on it. If you enjoyed watching the video and found it informative, then hit the like button, subscribe to our channel, and don't forget to ring the notification bell so that you always stay updated with our latest content as soon as it's uploaded. Thanks for watching, and I'll see you in the next one.